Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we're talking about neck pain, but we're going to do it a little bit differently than we typically do. If you're familiar with any of our material, then you'll know that we typically post a video once about every 2 weeks, and we at those times just post a video on maybe a condition that we treat or a case that's come in recently that's kind of at the top of our minds. But today, or this month rather, we're going to do it differently. June's going to be all about neck pain. So June has 5 Mondays. Each Monday we're going to try to release a video on a different type of neck pain, and we've grouped them into locations because that's what matters to you, right? Not condition, but kind of where you feel it and what it feels like. So today we're talking about lateral neck pain, or what that means is side of the neck pain, okay? So if you have neck pain, stick around. About neck pain, side of the neck pain. The first condition that we're going to talk about is in-laws. They can be a real pain in the neck. No, I'm just kidding. The first condition that we're talking about is one that patients typically come to your office. They say, I've got a crick in my neck, okay? So a crick in the neck, when I hear someone describes that, maybe it's a southern thing, right? But we've all kind of had one. You can typically get it if you fall asleep in a weird way and you wake up and you're like, ugh, the side of my neck hurts when I turn it a certain way. Or another thing that I've heard a lot is if people are watching TV and they have their neck turned a certain direction for a long period of time, things seem to get stuck in the side of the neck, and you'll have a sharp pain when you turn left, right, maybe look up or down. The thing that we need to understand about the neck is the vertebra, or the bones in the neck. It's almost like a chain, right? So you have your segments of your spine in your neck. Each one of them is it has a range of motion. It turns, it looks up, it looks down, and we have muscles that control that motion. The muscles in the neck are very intricate. You need to understand that. It's like little fingers projections that attach to each bone. So you should be seeing a picture of this as I'm talking about it. But what can happen in these areas if you hold that position or you sleep in that position for a long period of time? Two things can happen. The joints, or the bones, the joints in between the bones of the neck can get irritated and inflamed, and those little intricate bits of muscle where they have to attach those bones, they need to slide, right, when we move our neck. If they become irritated or inflamed, they can get stuck together. We refer to that almost like Velcro. You get Velcro between your layers of muscles at your neck. So then when you turn, or you look up or you look down, and suddenly those muscles can't slide, you get a pinch, you get a pain, and you get a crick in the neck. So what we have to do to help you with that pain or problem, we need to get that motion back. So we need to free up that Velcro, or those stuck layers in those muscles at the side of the neck, to free up that motion. If it's irritation at the joint, we can use chiropractic manipulation to free up that joint restriction, and then there you go, your crick in the neck is solved. Okay, so what's another cause of lateral neck pain, or side of the neck pain? Well, another one, and this is another thing that patients like to tell you when they come in, is I have a pinched nerve. And you know, if that is the case, it can be a thing. So you can have a pinched nerve. What we call that in the medical community is peripheral entrapment of a nerve. And so those same muscles that we just talked about in the crick in the neck situation, there's a lot of intricate muscle layers in that area, right? Another thing that can happen is you have several nerves that floss through those layers of muscles. So let's say you have a nerve that we're talking about, the suprascapular nerve. You should see a picture of it now. If you have irritation in those muscle layers where that nerve has to pierce through and run to where it needs to go, then you can get nerve pain, or a pinched nerve in between those muscle layers. It could happen in the layers of muscle. It could happen right up next to the spine, kind of as those nerves leave the neck. But if you get a pinch, that pinched nerve pain or problem, you'll get local sharp pain, maybe some numbness, tingling, burning in the side of the neck or down towards the shoulder. That's what it might feel like. What we have to do, if that is the case and that's what's causing your lateral neck pain, is we have to find where that pinch is happening, where the nerve is getting irritated, constricted, tensioned. Wherever that irritation is coming from, we need to find it and we need to reduce the irritation. So if that means loosening up the muscles and encouraging the nerve to slide with certain range of motion activities or really picky soft tissue work, then that's what we're going to do. If it's joint irritation right up next to the spine, we may manipulate the spine or adjust the spine to free up that range of motion for that nerve as well. But that's the pinched nerve scenario, which might cause side of the neck pain. Okay guys, so those are two really common conditions that we see in our office that can cause side of the neck pain, maybe even top of the shoulder pain. But again, this month for us is all about neck pain. June, every Monday, we're going to release a video kind of addressing a condition that can cause neck pain. Next week, Dr. Cervone's going to be talking about posterior neck pain, or pain on the back of the neck, maybe the top of the shoulders. So if you have a question about neck pain, maybe you struggle with neck pain of one type or the other, leave a question or a comment with the video, and we would love to address that question, get back to you on your comment. We'll either message you back, we'll leave a comment below that, or maybe we'll even address it in one of our later videos this month. But we'd appreciate the feedback. Share this video with someone you know if they have neck pain. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.